Journal. If you actively participate in any sports, chances are you could experience an injury. Dr. Russell Petrie of Hoag Memorial Hospital Presbyterian in Newport Beach explains the most common injuries he sees and the recommended treatments that promote rapid healing.
Sports injuries encompasses a wide variety of injuries and a wide variety of joints. The two most commonly injured joints in sports are shoulders and knees, but elbows, hands, back, feet, ankles, hips all get injured. My area that I focus on are injuries to shoulders and knees. In Southern California, our biggest culprits are probably soccer, football, rugby, because it's becoming more popular, and things that we don't typically see injuries from are bowling. The relationship between Hoag Hospital and Newport Orthopedic Institute is this. All of the surgeons and physicians at Newport Orthopedic Institute are physicians on staff at Hoag Hospital. We do all of our surgeries at Hoag-affiliated institutions. And so while we are an independent group, we are very, very tightly aligned with Hoag Hospital, and we work with the hospital to improve our operations and improve the experience for the patients, so we work very tightly with them. What has changed over the last 10 years is that our ability and our skill level to treat more and more complex pathology inside the shoulder and the knee has grown, particularly in the shoulder. I think many of us today think that we can actually take care of things inside the shoulder that we would never have dreamt of taking care of 10 years ago. And in fact, for a lot of people, arthroscopic shoulder surgery has become the gold standard because we feel we can actually treat a greater variety of pathology better. From the patient's perspective, it's pain. The arthroscopic techniques have a tendency to be much less painful. That's not to say that there's no pain. There's no way of getting around having pain in a rotator cuff operation. But the pain has a tendency to be shorter and less intense when we do things arthroscopically. People often ask me, if this was your shoulder, what would you do? And I tell them, I can't tell you that because I've never had this problem and I don't live with your pain. And so it's very difficult for me to tell them when they have to have an operation. But I'll tell you what most people do. And the key elements, particularly with rotator cuffs and then instability, usually it's night pain. Once people can't sleep at night, they want it fixed. If it doesn't affect them at night and it only bothers them during the day, then very often they will live with it. But once they get to the point where they can't sleep with something, not only is night being affected, now day is being affected because their night is affected and their sleep is disrupted. And at that point they're grumpy, they're short-tempered, they lose their ability to concentrate, and they want it fixed. The second thing is that when people can't do normal activities of daily living, bathing and dressing, those are sort of the two keys. When you get to athletics, that becomes a slightly different or more difficult population to talk to because it has to do whether or not it hurts them during play or is it only after play. So it depends on the person. But if you ask me what's the one thing that if someone says, my rotator cuff hurts, I can't sleep at night and I've done everything, time to fix it. Instability of the shoulder or dislocations is a little bit different. That happens to be one of my favorite things to treat. But once someone gets to the point where they're dislocating in their sleep, that shoulder's not staying in joint, needs to be fixed.